Hello and welcome to the Doc Podcast. I'm your host, Dr. Mike DeLuke, and it's my mission to help you lead a happier, healthier, and more prosperous life, both personally and professionally. Hello and welcome to this episode of the Doc Podcast. Today, I am thrilled to be joined by Dr. Staci Whitman. Dr. Staci is board certified in pediatrics, integrative dentistry, and naturopathic dentistry, and is one of the only dentists in the world to have her certification from the Institute of Functional Medicine. Dr. Staci founded one of the leading functional pediatric dental offices in the country, where she takes a whole body and holistic approach to her care. She is the co-founder of the Institute for Functional Dentistry, which is launching in the near future, and she lectures globally on functional dentistry and the oral systemic connection. She is also the co-founder of Feed Your Good Guys, or FIG, F-Y-G-G, Microbiome Friendly Oral Care. With a passion for optimizing the oral microbiome, hormonal health, nutritional status, and sleep and airway health, Dr. Staci is a sought-after expert and educator with a heavy focus on preventative dentistry, cavity arrest, and remineralization, as well as the oral gut-brain axis. She recently appeared as a guest on the Huberman Lab podcast, and I want to say she really did an amazing job representing the profession of dentistry. Some of what we're going to discuss on today's show includes how Dr. Staci became involved in a functional and holistic approach to dentistry, the problems with the current model of dental education, possible solutions to practice burnout, which many dentists are facing, the truth about fluoride and fluoride supplementation, the oral and gut microbiome and the impact that they have on overall health and wellness, steps you can take to improve your oral health as well as the oral health of your patients, and much, much more. This really is an amazing conversation, and I promise you this is something that will change the way you think about dentistry and about overall patient care and patient health. Please be sure to share the show with others. This is such an important message. We need to get this out to the public and to our colleagues to start to think differently about how we approach patient care. We have to get away from the reactive, mechanical approach that so many of us have learned and practiced over the years. We need to do better. We need to do better for our patients, for ourselves, and for the health of our society. Some of what you hear today may push your reality and may make you feel a little bit uncomfortable. And that's okay. That's good. That's where change comes from. We're not going to change the health of our patients if we're not willing to get a little bit uncomfortable. So without further ado, let's get on to today's episode with Dr. Staci Whitman. Enjoy the show, everybody. Welcome to the Doc Podcast, Staci.
Hey, Mike. Happy to be here. Thanks for having me.
So happy to have you here. Really, really looking forward to this conversation. We were just talking a little bit before we started recording here, and we share a lot of things in common. And even though I'm on the ortho side, we've definitely both bucked the trend a little bit in our respective lines of work. And it's kind of a kindred spirit when you meet people who are doing that. So tell me a little bit about your journey and how you got to this point, because it's safe to say you weren't trained to think this way in dental school. Most of us were not, to think in a more of a holistic, whole patient approach as opposed to a mouth-only approach. So how did you, and you can take it back as far as you want, how did you get to this point in your life and career to become the Dr. Staci you are today?
Yeah, it's a convoluted story. But so it went back, I think, very originally to when I was 10. I had a very significant bicycle accident where I avulsed permanent teeth and I fractured my maxilla, and it was just terrible. And so I was in and out of dental offices. And what I mostly remember, it was a very positive experience, but it was more, they were so wonderful with my emotional health. Okay. So we can just pin that for now. And so I was an art English major. I still don't quite understand how I ended up in dental school, but I was into sculpture. I worked with my hands a lot, and I loved science, and I loved the idea of healing people. My parents weren't the healthiest people. I lost them early to preventable diseases. And so I personally always lived what I thought at the time was a cleaner lifestyle based on the information I had. I was always interested on how can I optimize myself through nutrition, through exercise, etc. What things were maybe causing me harm in my life that I was unaware of, like, can I clean up my shampoo? Can I clean up my makeup, etc. My air quality, my water quality. And so now I'm in dental school. I was traditionally trained, and I got out and I practiced as a general dentist for many years. And I just was very dissatisfied with my career.
How long did you do general before you went to peds?
I did a GPR, and then so about 4 years I did dentistry.
So not a short stint, and that's enough time. That's
not nothing.
Yeah.
And I was in Boston, and I'm going to be very honest. I almost left dentistry.
Really? This is when you were doing general?
Mm-hmm.
Wow.
I really did. And the only reason I didn't was because of my debt. I truly believe if I didn't have the debt.
Isn't that interesting? Yeah.
The golden handcuffs, I would have left, because I just felt overwhelmed. I felt like nothing I did was making a difference. It was the same patients coming in. I wasn't able to get to them. I wasn't able to help coach them, to get them to quit smoking, to get them to floss, to get them to clean up their diet. I couldn't even have the time to unpack what their lifestyle factors were because of the way traditional dental practices are set up. And I also, quite frankly, didn't have the education, but I knew something was missing. And I felt like I wasn't making a difference. So then I moved to the West Coast. I couldn't deal with the East Coast anymore for various reasons. Just personal reasons, nothing against the East Coast. To the West Coast to slow down a little bit. And I still practiced as a general dentist here, and that's when I almost left. But then I thought, how do I salvage this career? I need to get upstream, and this is the root cause approach. And I said, well, how do I get more upstream in dentistry? And it was with kids. It's pediatrics. It's education. I need to teach the parents and arguably even talk about pregnancy and preconception and educate the children on the importance. So I went back to school and became board certified in pediatrics. I worked as an associate, and the same thing happened, except now I'm in a turn pediatric practice where they're just going through like the turnstile. And I arguably was even less satisfied than before. So I realized I have to open my own practice, and it's been a slow evolution, but I had changed to be a more functional, biological, holistic, whatever you want to call it, pediatric dental office. And it's come through my education, CEs, reading books, reading research, but less with dental colleagues, I'd argue, and more with like functional medicine doctors, more with naturopathics. I became a certified health coach. I went and took advanced nutrition training. I'm functional medicine certified. And as you go to these conferences and meet people, you realize you're not a lone wolf. I thought for so long I was so isolated. And I was the only one thinking this way. And then you realize, no, take a number. There's a lot of people thinking this way. And there's a lot of dentists that want to practice differently. And many of them just don't know how. And not everyone is like me, that I'll just fly across the country to hang out with a colleague for a couple of days to like job shadow them. Not everybody can do that. I was very fortunate. And so it's been piecemeal, but now I have this incredible practice where we take a root cause approach. We really focus a lot on the oral microbiome and its connection to gut health, but just how all the systems tie in, and including airway health, which I know is your passion too. And how that's so foundational. And that started with me, with my daughter, who's now 12, who struggled with airway, breastfeeding, and a missed posterior tongue tie, narrow palate, and open mouth posture, and all the things. And then she started having behavioral issues and like just sensory issues. And I couldn't figure out what had happened in her life in any way.
About how old was it when you were figuring that out with her? Or how old is she, excuse me?
I really noticed things around when she was 3. Okay. She was bruxing.
But you didn't know at this point. You weren't thinking that way.
I wasn't trained. I wasn't trained in it at all. I mean, we had a terrible time breastfeeding, and it was kind of like, you got this, mom, breastfeeding's hard, or just start formula feeding her. And I just didn't know. You don't know what you don't know, So, but it did propel me on this journey. And so I took additional airway training, growth development training. it's been the best thing in my career. And I really do believe I'm helping so many people, because we know childhood is foundational, and how a child grows and how their neurosensory integration begins is foundational for what type of human they're going to be. Mm-hmm. And of course, we can unwind and unpack these things, but why not just start off on the right foot, or catch it as quickly as possible to course correct issues. And so since practicing that way, I am so satisfied with my career.
How long ago would you say that you made that change?
Yeah, at least a decade ago.
Oh, wow.
I would say. Yeah, it's been a while, but
so you were ahead of your time, because it was not something that was even really being spoken about at many meetings, or we didn't really have podcasts necessarily back then. So, that's a while ago.
Yeah, when I was an associate, I was already starting to do this additional education kind of after hours myself, but it wasn't until my daughter was about 2, which was 10 years ago, that I really dove in. And I'm still constantly adding things to my practice. I mean, right now we're talking about micronutrient deficiencies and mycotoxin exposures and heavy metals and oxidative stress. And like, how are these things impacting our children, and newer diagnoses like PANS and PANDAS, and all the blue light and screen time. And, it all just creates this really great practice. And certainly it's not the right fit for every patient, but for those patients really struggling to find answers to get their kids well, it's such a wonderful opportunity for me to provide guidance and education.
That's really fascinating to hear that. That's why I love hearing people's stories, as my audience knows, because people see you as who you are today. Then they may know of you and know what you do, or some of how you practice. They don't realize the journey you went on. And it's almost zero. I would say almost to a person. Everybody who has gone on this journey and really transformed the way that they think about what we do as dentists, or even physicians who have come on, or even someone in the myofunctional therapy space, they went through a bit of a crossroads in their career, came to kind of that proverbial fork in the road, and had a decision to make on what they wanted to do. And oftentimes it involved a personal story too. And it involved a child, or a friend's child, or a family member, a parent struggling and suffering with airway and breathing. That tends to be one of the things. And do you know Beth Lambert? Have you heard of Beth? She has collaboration cures. Oh, I'll have to, okay. She is amazing. She was on the show not long ago. I can put a link to her episode up in the show notes for our show, but she's amazing. And she was talking a lot about this total load hypothesis. As you're speaking, I'm thinking and how overwhelming it can be for parents, for patients, because there are so many things that are exposing us, and just trying to distill down a little bit. What are the hot points? What are the things that are really jumping off the page that are impacting kids? So how have you been able to start to incorporate that into a practice? Because there are so many things. So how are you kind of distilling that down? And what does your diagnostic process look like today? Hey, everybody. Quick question. How many kids are you seeing who are mouth breathing, snoring, not sleeping well, maybe struggling with focus or behavior in school? You know something's off. But we're never taught how to treat these patients early. So we wait for more teeth, wait for maturity, wait for the permanent dentition. Meanwhile, that child keeps suffering. Well, it's time to change that paradigm, which is why I've partnered with Dr. Daniel Camacho to launch the Early Orthodontic Treatment Comprehensive, a hands-on 2-day immersive experience in Fort Lauderdale, Florida, this November 13th and 14th. You'll learn to identify these patients early, read CBCT images, coordinate with medical and OMT colleagues, and deliver proactive dentofacial orthopedic treatment. You'll study real cases, then watch it done live on actual patients. So you'll return home with the confidence needed to implement it in your practice on day one. And the support doesn't stop there. The registration fee includes my full 26-hour online course, a live remote case review in spring 2027, and a full year of discounted coaching. And if you enroll by June 30th, you can save $1,000 off the registration fee. We're keeping this intimate, just $20. So click the link in the show notes and grab your spot before it's sold out. We'll see you in Fort Lauderdale.
Mm-hmm. Yeah, great question. So I look at myself as a guide in a lot of ways. I'm there to help guide the parent because it is so overwhelming and you can't throw everything at them at once. I can't say, your child has cavities and they need to floss and oh my gosh, their tonsils are huge and their palate's narrow. And also I think they have gut dysbiosis and they have eczema and
Right.
Have to slow your roll.
Yeah.
This is a skill that you have to learn. But so that's first and foremost. So to me, when I look at a child, the biggest things I'm always looking at initially are nutritional status, gut health, and airway. I don't care about their teeth. It's a different way of thinking.
Yeah.
And this may not resonate with every provider out there. And I say this with the best intentions. This is not meant to be critical, but we are all trained to be dental technicians.
Yes.
Okay. We are taught to be essentially microsurgeons. That is great. We need to fix teeth. We need to fix occlusion, fix a smile, etc. We do not have dental physicians in the world. How does the mouth connect to the body? The oral systemic connection. Medicine is, I hate how it's become compartmentalized.
Yeah, so siloed.
Nothing is siloed. Everything's connected. If you have gum inflammation, you have systemic inflammation, okay, etc. If you have cavities, that is a sign of metabolic issues. That's a sign of nutritional deficiencies. That's a sign of dysbiosis. And that's not just staying in the mouth. It's going to impact the whole body. So I look at those things first. We do a very deep dive. My intake form is obnoxious.
I would imagine it's pretty intense. Yeah.
It is. We talk about environmental toxin exposure and we talk about birth. What was the birth of the child like? Was there trauma? What was the mom's health and mental, emotional status while she was pregnant? Any exposures in the family, and then deep dives into nutrition. Not just quick. We're not just saying, oh, do you drink Coke or candy? I mean, deep. I want to know what they're eating, when they're eating it. I want to understand their macros. I want to understand everything about this child's life up to this point. And then, very often they're a family that even thinks they're doing everything right. There are works for improvement. Okay. They're snacking, they're sipping. They don't realize that acidic foods can cause damage, or they're not getting enough protein. They're not getting enough micronutrients, etc. And then of course the minute I look at a child, you know this, like you can do a quick airway assessment, just how they walk, at their gait. And through how they walk in and behave, I can sense their neurosensory processing. And then I'm thinking, well, what could that be from? And that comes back to the gut too. And so I am functional medicine certified and have my functional diagnostic certification. I'm not yet running these labs necessarily through my office. Okay. I will order vitamin D testing if needed, but we work in collaboration with naturopaths and functional medicine doctors who are on the same page that if I think this child needs a deeper workup, and craniosacral and chiropractic and things like that as well. So that's how we start. Now you'll say, how do you fit this all into an appointment? I do spend an hour with my patients. It could be much longer, I'll be honest. My team is exceptionally well trained to support me and do a lot of the education. But here's the, if someone wants to practice like this, is handouts. Okay. Creating detailed PDFs and handouts and checklists and things you want them to become educated on. And they leave with that in the new patient packet. They get a stack of information when they leave tailored to them. And then of course my social media has helped, and I have education on my website too. And so a lot of this, if the parents who come to see me, they're often very well prepared when they come in because they have already read things that, on my website or have followed me on social media, or my team's already sent them some preliminary handouts. So they come in already prepared, and that is helpful but not necessary. And, don't be afraid to have a family come in for a follow-up for more education. The child doesn't necessarily even need to be there at that point. But that's how we begin. And so unless the child comes in with pain, like truly something that is acute and I need to address, then to me, the teeth, we need to address them, of course, if there's cavities or things, but it's not the most pressing issue because I need to teach and figure out the why. What were the antecedents and triggers upstream to get the child there? And it's not always as simple as candy bars and Coca-Cola, in fact, most of my patients, I'm blessed, but they come in, they're doing really great. I mean, they're cooking from scratch and the kids are outside and they're just on paper thriving, but yet their teeth will be bombed out. And we're learning that there's so much more involved to it. And hypoplastic enamel, to me, I'm seeing it clinically as an epidemic. I mean, children erupting mineral deficient. I
was going to say, do you think nutrient deficiencies in that or vitamin D? And yeah.
Yes, D. We know humans globally are chronically vitamin D and magnesium and mineral deficient. A lot of it's because of what we've done to our soil, because of our farming practices and the pesticide industry and things. And
then staying indoors and not getting sunlight exposure. Yeah. Yep. Absolutely.
Exactly. And if you get into if you start looking into blue light and what that's doing to your hormone circadian rhythm and your mitochondria, and how does that impact dental development? I mean, this goes into conception and pregnancy too. So it's overwhelming. I think it's so interesting and fascinating because I like to have answers to provide. And also knowing as a pediatric dentist, if I catch these issues before their permanent teeth are fully developed and calcified, we have opportunities to optimize this child while their permanent dentition is developing. And that's the most important message I'd like to share with parents who seem overwhelmed is like, listen, I know this is hard right now. Your child has all these cavities. Maybe they need anesthesia because they're pre-cooperative, but big picture, let's figure this out and make changes so they're they won't be a teenager and adult going through all of these issues, and let's get their airway optimized early. And I know that's a whole other, we'll get there. But so it's great. I mean, of course, I always want to do more. I feel like I could spend 3 hours with a family, but I feel like I have it pretty dialed that they leave at least with a very different experience. And what's really cool is I have very few, I shouldn't say never, but very few patients that come back with repeated cavities. Once we clean them up and we really educate and we focus on the why, and again, you have to have the right patient population for this, but I think there's a shift. There's a movement toward this. Yeah. And we're in the middle of a big healthcare shift where patients are taking control of their own health and they want answers. And it's really rewarding. And so my mission is to not only help patients, but to help educate providers too, to how to think a little bit differently and look at the mouth a little bit differently, like connect it back to the human that it's attached to, and learn to practice a little bit differently. And I think it will help with burnout and patient and just job satisfaction too, and sense of purpose. I mean, burnout is really high in dentists right now, and dentists, I think, are struggling. A lot of dentists are. And I think it's because of how we practice for many reasons.
Yeah, I completely agree. I've had people on this show actually who have struggled with burnout. I had someone whose husband was a hygienist and her husband took his own life because of the burnout. It's real. And I never really thought of it the way you just explained it, which was that could be a solution to the burnout. Right. It makes perfect sense when you said it, but I'm thinking, right? Yeah.
So I was doing all these things, but I wasn't totally practicing what I was preaching. And to me, COVID in a way was a blessing. I think many people had this where I was thrown off the hamster wheel.
Yep. Same.
I was forced to look in the mirror and I was not well. I was sick. I look at photos of me. I'm so inflamed. I'm so tired. And I wasn't taking care of myself. And because what I was trying to do was fit, a round peg into a square hole, or whatever that saying is, because I was trying to have this like functional pediatric practice, but I was putting it into a traditional model.
Interesting. Yeah. I know a lot of people are struggling trying to do that.
It didn't work.
Yeah.
And so I had to completely change my schedule, the templates of the times I book for patients, change my I'm
billing,
doing
I'm sure, right?
Billing with my insurance. And I do take some insurance, but much less, right? And it's scary to do that, but also I think we need to prioritize our health more. Yeah. I know dentistry is hard. The overhead is insane and the expectations for us are nuts. But there are ways to restructure things that you can actually lower that overhead and extend your career, and anyway, so I cleaned up myself and I started working with a functional medicine provider. And that was really my first exposure to it personally. And oh my God, it was life-changing. It was absolutely life-changing. I mean, my hormones were in complete disarray. I had rampant parasites, like just things that you wouldn't know unless you tested. And I feel wonderful. I feel so great. Like this is reverse aging, right? And so I've not only become happier emotionally and mentally and more present for my family, but I'm more present for my patients. And I'm going to work longer. I mean, I love what I do now. And I don't know how that's going to evolve. Like there's all different fun things that we can do with our careers. But I encourage everyone to take that moment to jump off the hamster wheel and think, like, what do you really want? I don't care that your faculty said you have to work 8 to 5 Monday through Friday. Who came up with that?
Right.
Who said that?
Right.
Do what you need in your life with your family and your commitments and your goals, and your team can deal with it too. Like, we might lose team members, but your patients will benefit from that because you will be more present and able to help and heal. No,
it's really well said. And it's one of those things that something has to change, right? It's kind of like you said, on a national level, there's things we know in all of medicine has to change. Big pharma, it's a pill for everything. Treat the symptoms instead of treat the cause. People are waking up to this for sure. I feel like the public as a whole is doing a better job working up to it than the professionals. Yes.
Right. It's going to have to come from the patients. Yeah. I mean, it already is. And I see this with the fluoride conversation. I mean, we can go there.
Yeah,
but it's patients that are coming demanding options or at least open-minded conversations.
Yes.
And providers have to get with it. You have to get with it. You cannot be so narrow-minded. It's not about you. It's about what your patient wants and needs. Okay. So meet them where they're at. Now we can re-educate them if their information's incorrect. But so often I hear the gates just come down and you are not willing to even have the conversation, and it's my way or the highway. And if you don't do this, and guess what? Your practice is going to fail.
Yeah.
Those days are over.
Yes.
It's done. Yeah. Your patient runs your practice. And until you have that mindset shift, you will not be happy and your practice probably won't be successful. I mean, the internet is a blessing and a curse, and it takes one bad review or a couple moms at a play date on a playground to, like, quite frankly, like, really harm your practice. So patients first. The way I look at it, I'm on a team with my patient. We're teammates.
Yep.
So, or maybe I'm the coach. I don't know. But, like, it's not the me show. It's not the Staci show.
Yep.
I'm just here in the periphery. I'm a guide. I'm a guide and an educator. And I'd argue I try to be a healer too. And that is where I get surgical. I fix the tooth. I pulled the tooth. Whatever I have to do. I do the expansion. But it has taken mindset shift. Now, what I'm hopeful and I do see is the younger generations of medical and dental providers. They do think differently.
They do.
And that's so reassuring.
Yeah, I agree. I coach and help a lot of residents and young docs, and they get it. They think differently. They see differently. They don't want to follow down the path of just burning out like so many of their predecessors did. Interestingly, too, a lot of their faculty that are teaching them, this isn't a knock, it's just the truth. They never did this in the real world, a lot of them, or they did it on a limited basis, a lot of them, right? Or they so it's, they just, but that's what,
or they started up, or they didn't have successful practices.
Yeah, a lot of people don't know that. And I say that openly on the show, but the vast majority of faculty in a lot of dental schools, not all of them, there's some great, especially part-timers, and you'll have some exceptions that had a great practice and then devoted the rest of their career to education. A large percentage of them never did this in the real world. Or if they did, they didn't find fulfillment in it or weren't successful in it and then went into academia. But that becomes who we learn from. That's our reality. That's our truth, is those people, as you said, who says this is how you do it. And they only present to you the data and the evidence that they believe in. Obviously, they might present some things a little off the beaten path, but not too much. Or they may just say, hey, there's another concept, but this is the way we really do it. That's like with ortho, right? We learn about Corcini and Harvold and all these things and the growth and development and the anthropological side. But it's kind of like, yeah, but that's not really what it is. This is what it is. It's about, straightening teeth and the biomechanical side. So
it's textbook education instead of real life clinical applications. And you need all of it. And you also need patient experience, because every patient is different. And
we're not doing this in the schools.
That's right.
None of this is happening.
Differences. I mean, it's bio-individuality. We all need and respond differently to different things. So
yes, completely. And on the fluoride note, that's been interesting to me recently to watch that, because I, when I was a county president of our society back early in my career, I wrote a letter to the local paper in favor and support of fluoridation, because they were talking about taking it out of our community water supply, because that's what I had been told. So I was parroting that, right? I come from a family of dentists, and they're like, fluoride's a good thing. I mean, we were like the first ones that they tried the fluoride trays on when you were kids. Like, it was just coming out around that time. They were doing the topical. So I'm salivating just thinking about that. Those.
Yeah, that's like that flavor and what it does to your parotid glands is like imprinted forever.
It's amazing. It like
80s. I know
that's it. That's it. And that styrofoam. Oh my gosh. But so as we both have to swallow to stop our salivation, but the part of it that was interesting to me is I just try to keep an open mind on this stuff and think, well, maybe there is another side. And I don't think that's so much of an ask. I've been shocked how much the establishment of dentistry has come out in favor of, and not even in favor of, there is no room for discussion on it being, and I don't know why. I mean, I don't know. I know people high up in the 80s. What are your thoughts? Like, to me, I hate to say this, but I think it always comes down to money. So something I feel like has to be, but like, is it because they are sponsored by Procter & Gamble? I mean, what is this about?
I'll give you my theories. This is, again, my perspective. I'm speaking my opinions. And I'm with you. So Portland, Oregon is not fluoridated. It's never been voted in. Okay. But the last time it was up for ballot was like 2011, 2012. And I was coming right out of residency, and I was high on my horse, and I was yelling. So this was right around the time I was transitioning, but I was even thinking open-minded about more whole body dentistry and still pushing for water fluoridation. So I was on the water fluoridation, the American Water Fluoridation Society's volunteer committee, picketing, handing out buttons and flyers, and like kind of yelling at people that if you don't want to fluoridate water, what's going to happen to our children? Their teeth are going to decay. I mean, it's the same old thing, paradigm. Did I have any basis for the things I was saying? No.
Same with me.
Had I ever personally gone and sat and studied it and looked up the concerns? No. I didn't even question it because it is so indoctrinated in us.
Yes.
But if you take 10 minutes, literally, and you just look at some of the data, you have to push back from your desk and say, whoa.
Yeah.
maybe I should unpack this a little bit more. And so what changed me, it was during that vote, during that time period when it was up for ballot, I went to a debate and I sat on the pro-fluoride side, and very proud of myself to be over there and judging these people who I didn't even know, thinking tin hat brigade, woo-woo, like these people are kooks, right?
Yep.
They get up there, they speak so eloquently, so scientifically, they can cite data point after data point. And I honestly, the ADA doesn't do that.
No.
The pro-fluoride, they just say the same thing over and over again.
They say it's safe and effective, believe us, literally.
Safe and effective.
Yeah.
Or they'll say the best thing in public health and
community water fluoridation. Right. Exactly. Yep.
By 25%. It's the same thing.
They love the 25%.
Which, by the way, that is old data. If you are quoting that, you are wrong. Yeah. And I will debate you on that. Look up.
Did you see the Cochrane review, the 2024
latest Cochrane review?
Yes. Yeah.
Which, why are we ignoring that?
Yeah.
You can't cite the Cochrane review from 2015 and ignore the Cochrane review from 2024.
Yeah. And just so the audience knows, they said there's insufficient evidence to determine the effect of cessation of community water fluoridation on caries and whether that results in a change in disparities in communities with lower socioeconomic status. They could not conclude that, because that's the other thing we hear is if you take it away, the underserved are going to just be riddled with decay. We don't ever talk about the fact like, well, maybe we could go teach these people how to be a little more proactive in their oral health and systemic health.
That's been disproven. I mean, you look at European countries who have taken out water fluoridation. Now, yes, they did implement other programs, or just countries and areas that have never fluoridated. There is not a difference. That there are data points on that. The World Health Organization has this if you look for it, but it's not front and center. And the Cochrane report also said it reduces decay risk by only a quarter a cavity to a third a cavity per person. That is not statistically significant.
Right.
So the 25% thing, if you hear it, if you read it, if you're saying it, you are incorrect based on latest data.
Yeah.
Period. That's it.
And I will link that in the show notes too. I'm happy to link that.
But also, we know Featherstone showed us that fluoride works topically, not systemically. They teach this in dental schools. So if you really want to fight for something, fight for topical fluoride application, fight for programs that educate on diet and nutrition, maybe going into schools. Can they opt into fluoride rinses or fluoride applications? Or can we get fluoride toothpaste to patients more readily? And people will say, well, people don't have access to toothpaste. That is hogwash. You can go to the dollar store and buy a tube of toothpaste for $1. And I'm sorry, but can people afford toilet paper? Yeah, we're not. It's the same thing.
Right.
This
soap.
These aren't good arguments.
Right.
Fluoride toothpaste works, okay? But I would counter argue it's still a Band-Aid. The real issue are all these other things that we are talking about. Now, I get that this is complicated and many people can't access dentists talking this way, educating this way. They may not want to change their behaviors. But here's the thing. If water fluoridation worked, why are cavities still the top chronic disease in our country when over 70% of the United States is fluoridated? That makes no sense.
It's a great question.
I'm not happy with those statistics. I'm not impressed by that. So we are missing an opportunity to fix the decay and caries crisis.
And it's from the same people who tell us you can't do anything without a randomized control trial. And to my knowledge, and people please write into the show and message me if you have found evidence of a soundly conducted randomized controlled trial. And I'm not one who believes you need an RCT to have evidence basis. That's not what SACIT intended for. But there are a lot of people who do. And anytime you bring up anything on airway or airway health or anything that we're talking about, we'll say, oh, well, we are evidence-based, right? We only base it on evidence. And what is that evidence basis? You need randomized controlled trials and systematic reviews. Community water fluoridation is solely based on observational data, population studies, expert panel systematic reviews. They haven't even studied it. They haven't studied the side effects, the efficacy. It became just as you said, indoctrinated that this is what it is. And I challenge anybody to produce, even the CDC, when you read through their actual document. Actually, I want to quote this because I wrote this down. A high fluoride concentration in sound enamel cannot alone explain the marked reduction in dental caries that fluoride produces. The prevalence of dental caries in a population is not inversely related to the concentration of fluoride in enamel, and a higher concentration of enamel fluoride is not necessarily more efficacious in preventing dental caries. I will link that to the show. That is the current CDC document on community water fluoridation. Oh, yeah. So where is the ADA coming from? And I like the ADA. Nothing against that. I just try to call balls and strikes on this stuff, and I don't get it.
I've thought about this. So this is my opinion. I think this is why so many dentists get heated up about it too. And arguably, I can look back at why did I get heated up about it? Good point. It's hard to accept that you've been miseducated or misguided by your industry, your mentors, your institution, and also no one's intending to do harm, but potentially we are. And so it's really hard to look in the mirror and say the way I used to practice was maybe harming my patient. Yeah, now, so true. I think it takes a unique personality to admit that to oneself. That doesn't feel good. I look back at some of the things I did in my diagnoses and like my over treatment and the way I treated patients and like, you need to stop breastfeeding because it's causing decay, to this new mom. Terrible. I'm embarrassed. I'm shamed by it, but it's just part of learning. Like we're forever learning and evolving. So there's that, but also the ADA is pay to play. I mean, we need to understand that.
Yeah, of course, it's a business.
Accept money from GlaxoSmithKline and Colgate-Palmolive and the American Academy of Pediatric Dentistry several years ago took money from Coca-Cola. Now they backpedaled on that very quickly because of the backlash, and it's really hard to see where some of the money comes from. Like we don't have a data and information. So that's
such a good point. AAO is the same way, by the way, taking money from Invisalign. And there was a whole big thing with the AAO and Invisalign. And there was an ad campaign that Invisalign did. And it basically talked about like braces aren't cool anymore. And then so the AAO president, John Callahan, who I know well, wrote a letter to the Invisalign and targeting them. But it stopped shy of saying, we are taking a firm stance against you. And they hide it against, we can't, antitrust, legality. No, you don't have to take their money. And then the next meeting comes up, Staci, and who's one of the key sponsors of the entire meeting is Invisalign. And I'm like, can anyone else see this hypocrisy? Come on. And I'm not saying you can't have sponsors and all that. I get that. But at the same time, it does cloud your judgment. It does. It's inevitable.
Yes, absolutely. Yeah. And so I don't think anyone has ill intentions. I just think it's what we will not go there, but we were speaking about it offline, how we can convince ourselves of a certain narrative and that is good and that is bad. And if that person believes that, they are bad and ill-willed. I don't think anyone on the ADA is ill-willed. Agreed. Or bad. I don't think any dentist that's really pushing for water fluoridation is ill-willed or bad. I would encourage you to be more open-minded and to spend some time with the literature that is opposing your view. Because I found it pretty hard to walk away from my lit review not feeling sick to my stomach.
I felt the same way.
If you watch the TASCA trial, watch the testimonies, like listen, they're on YouTube. These are not dentists. These are epidemiologists, endocrinologists, neuroscientists, biochemists who will tell you what fluoride can do in the body. And everyone's going to say, dose makes the poison. Dose makes the poison. No one's saying if you drink a glass of fluoridated water, you're going to have an issue. This is accumulation.
Yeah. Do we even know the dose? I mean, I know they say the 0.7 parts per million or milligrams per liter, but we don't know the cumulative dose of this. There was another part of that CDC report, or maybe this was EPA report that I saw where there are levels. First of all, they did actually, it's in the report that certain data were concealed for how high some of these community levels were, but they have the maximum contaminant level. It was 4.5 0.0 parts per million or milligrams per liter. That's almost 6 times the safe level. And that's in communities in the US. Like,
I know. I've interviewed people from water bureaus who say it is so hard to titrate this accurately. And I've seen reports from our local community around here, and I've seen it as high as 2.2. So
which is 3 times.
Yes. So this is a good point. And then we can move on to something else.
Yeah, but absolutely.
If you don't believe in the neurotoxicity, or for me, I want to say, hey guys, look about what it's doing to the gut microbiome and the oral microbiome. It's antimicrobial. It's not selective. No one speaks of this. There is data on this. We know the gut microbiome is foundational for health. If you don't believe that, you need to get out of medicine, quite frankly. I don't care if you're conventional or functional, whatever. That is fact. Microbiome is king or queen, whatever, however you want to look at it. So the EPA under oath during the Tasker trial, when asked by Michael Conant, said, what is the window of safety? And it's 10x. 10x. So most will agree, based on the NTP report and some of the data, that at 1.5 milligrams per liter, there do seem to be some negative issues.
Well, that's their stance, is that ours is only 0.7. So then it's fine, right? Yeah.
However, that's 1 liter. So I'm only allowed to drink a liter of water a day. Right. The American Academy of Pediatrics wants pregnant women drinking 3 liters of water a day. So there's an issue. It's the halo effect. But let me digress back to the EPA's thing. Why do we have a margin of safety? It's to protect vulnerable populations. Who are vulnerable populations in the community water fluoridation discussion? It's pregnant women, it's infants and children, it's people with kidney disease, it's people with calcium deficiency, iodine deficiency, and genetic polymorphisms, and people that have fluoride sensitivity, which is a real thing. It's to protect that part of the population. And then, so let's say the EPA decides to lower it to 0.15. I mean, is that even effective? I mean, it's the Cochrane report says it's not even effective at current standards. So it's complicated. And then there's also just patient rights. Like patients should have consent to this. Yes. It should be risk and benefit should be discussed with them. The potential for issues. I mean, this is the argument that's happening right now in Texas against Colgate and toothpaste, is that it's not clear what the negative side effects are for over-ingestion. It looks like Colgate is going to change their labeling as a result. So, I mean, so a parent should have a decision. I mean, my girls are 10 and 12. They've never been exposed to fluoride at all. They have no caries. I see this all the time in my patients. And I see patients that come in that use fluoride toothpaste and drink fluoridated water, and they have cavities.
Oh, I practiced in a community that was fluoridated, and I mean, there was rampant decay in these kids.
Rampant. If it worked, we wouldn't have this high caries epidemic.
And we used to, as you alluded to, and I want to just underscore that for a second, because we used to think that it was incorporated, hydroxyapatite became fluoroapatite, and that made it a stronger crystal. I can picture the lecture I was in 25 years ago where they were showing the different crystalline structure, because at Stony Brook, they actually had quite a bit of research on this. We now know that that's probably not actually the systemic benefit, and that's in the CDC report as well, really moving the needle much. I mean, there are really very little data, if any, to substantiate the systemic benefit. Am I right in that?
That's right. Absolutely. Yes. Yeah. Maybe it's getting, I mean, it might be getting incorporated into the saliva a little bit and helping with the
topical side,
acid resistance a bit, but that it's very minimized. I mean, again, the Cochrane report, and it's topical, and look at Featherstone's data and what they're teaching in school. Just do a lit review. But again, at the end of the day, as someone who likes to focus on root cause medicine, this argument is lost, because I don't care if you use hydroxyapatite toothpaste or fluoride toothpaste or theobromine or coconut oil. The issue is the diet. The issue is the eating frequency. The issue is how we're breathing. The issue is we're mineral and vitamin deficient. And until we start focusing there in the microbiome, none of it matters. It's just extra credit. These are products that help reduce risk, but they're not going to eliminate the risk.
No.
And So this is what we're missing in all of it. And I think it should be a parent and a patient's choice.
Yeah.
You know, you go over risks and benefits. If they do, I'm tired of the shaming. Why are we shaming patients?
I think you said it comes out of fear, insecurity. Actually, I'm giving a talk probably not long after your episode goes live that it talks about the state of orthodontics in the airway awareness today. And a lot of it is, I'm going to distill down some of those exact things and the psychology of this. Psychology of change is hard. And especially when, as you said very accurately, you're dug in on this. You've treated so many patients this way. You've been telling people for years and years and years. I give you a ton of credit because it's not easy to walk back from that and say, I was wrong. And they're going to say, well, did you harm me? Or were you hurting me? And the thing that I think people get caught up in is people understand that things change, times change. We learn more and especially in this tech boom we're in now and with AI. If you just are honest with people and say, we did the best we could with the information we had. I feel like looking back, many people will grant grace. I feel like if we don't start doing that now in 5 years, they're not, and they shouldn't.
Well, I agree with you. And I think that's another component with the ADA potentially is litigation. I mean, this is how I feel certainly about mercury. So once you have the data and then you still proceed to make recommendations in a certain way, I think you are liable at that point. And certainly that's where we're at with the mercury data. I mean, so it's just ridiculous in my opinion. We look to our EU colleagues, they have eliminated it and we should do the same. And we're a litigious country, unfortunately. So, and especially when you start talking neurotoxin in kids.
And IQ and,
it's a slippery slope. I get it. And I'm sure there's a lot of legal counsel involved in PR. And they're just saying, we're going to fight this. Like, don't back down ever. But I respect that you are still admire the ADA. I'm not going to say anything bad about it, but I've lost respect because they're cherry picking data. And we need to be sharing the latest Cochrane collaborative report. And if they could just present both sides, okay? And let the provider make their choice. But it's starting to get a little bit, if you don't recommend this, you're, practicing inappropriately, which is silly. I mean, that makes me nervous. Like,
and to your point, with the ADA, I have been impressed. One of the reasons when I said I like them, I have nothing against them. I feel like they've done actually a really good job, especially compared to the AAO on the airway side. Guys like Steve Carstensen, they've been really. That's why I said they've done so much good in that arena. And then they have the fluoride side. I'm like, guys, what the heck? Like on one side, you're so far ahead and you're pulling along the orthodontic community, but therein, I guess, lies the rub on that, right, Staci? Why is the orthodontic community doubling down on the anti-airway side of things? Because they're all in leveraged on it and they have more of an inherent liability. The ADA doesn't on the airway side and the early intervention side. So they can, right? I mean, it makes sense when you stop and think about it. Everyone's going to kind of protect their turf to CYA.
And people don't want to change. So with fluoride, for example, I still offer fluoride varnish in my office. I want to be very open about that. I am not anti-fluoride. I challenge water fluoridation specifically, and I'm open to other means of remineralization as alternatives. Okay. And there's ones that I prefer over fluoride, but I have plenty of patients in my office that still use fluoride. I do not write fluoride prescriptions, and if asked, I will give my opinion on how I feel about water fluoridation. But we do need options for patients. And I think I lost a lot of money when I didn't start pushing. Like, you kind of sell the fluoride varnish to your patient. Let's be honest. You need it. You need it and you need it. I don't care what your decay risk is. You have never had a cavity, but you need it.
Then it's preventative, right?
Doesn't matter how old you are. I mean, some practices can lose hundreds of thousands of dollars a year.
Yes, that's such a good point.
So even if you're not consciously thinking that way, I think that's deep down within you. Plus, it's like, when you have a turn and burn practice and you don't have time to unpack the why,
yes,
you feel like, well, gosh, I need to do something for this patient.
Right. I'm doing something.
So here's ClinPro 5000.
Yep.
Bam, call it a day. And at least I feel like I helped. And it's just not the way I want to practice. That's just what it is. It's not the way I want to practice. And I don't think if we continue on this way, we are not going to get any healthier, and our caries rate will remain as is, but arguably it's going to actually go up because the processed food addiction is worsening. And we can see that. Go to any public space right now and look at the kids and tell me what's happening.
Yeah. And how much of that, you touched on it a little bit with the fluoride, but I know you have a ton of knowledge in the area of oral microbiome and gut microbiome and dysbiosis. What are you seeing in that space? I know you could get super granular on it, but from kind of a 30,000 foot view initially, when people hear that, I think most people now, they know gut microbiome is important, probiotic, prebiotic, postbiotic, right? We kind of have a sense of that. The medical community is finally starting to come around on that a little more. They have a ways to go, but at least they're talking about it. What does it mean in the mouth? You can tie it in if you want to the QACs, quaternary ammonia compounds, and antiseptic mouth rinses, fluoride, food, diet. What is happening to our oral microbiome, and how is that interacting with our gut microbiome?
Yeah. This is still very new. It's an exciting time. So if this piques your interest, jump on, because you're in the early stages of this and you will be considered a pioneer. So our oral microbiome, it does so much. It impacts nitric oxide production. So that's cardiovascular health and health. It influences the calcium and phosphorus exchange in our saliva. It obviously, is terrain theory. So is your oral microbiome thriving and diversified? In which case, if you do get exposure to strep mutans or candida or another virulent microbe, like, can you crowd it out? We swallow 2,000 times a day. So if we have periodontal disease, P. gingivalis, F. nucleatum, T. denticola, this is going down into the gut, and the mouth is the gut. I need dentists thinking that way. You are a gut doctor. You are just at the beginning of it. Okay. So it's all interconnected. It's bidirectional. I believe you cannot have a healthy patient, especially periodontal wise, unless you clean up their gut first.
Interesting.
You have to focus on the gut too. And vice versa. If you're listening and you're like, well, actually, I've been working on fixing my gut health with my doctor. Are they talking about your oral health? Like we need to treat them the same. And we all know these pathogenic microbes are impacting and increasing risk to Alzheimer's and dementia. It's impact fertility, cancer risk is increased, mental health, mood disorders because of what's happening in the gut with neurotransmission, and just how they interact with each other, mineral absorption and ion exchange and immune health. I mean, we are just learning how these different sequences and complexes interact with one another. And so I hope to see oral microbiome testing standard of care soon. Now, I would argue it's hard in pediatrics, and I've done some pilot studies because the pediatric microbiome is changing a lot because kids put it in their mouth all the time. But with your adult patients, especially periodontal patients, if they are just coming in for scaling and root planings over and over and over again, I think at some point that's going to be out of scope, out of standard of care. I really do. We have to be focused more with data and metrics. And we're learning about what protocols should be implemented based on the different bacterial loads that you have and how to diversify. So I think it's paramount. And I think we're just going to continue to learn more and more about it. I mean, it seems to be a big area that's about ready to blow up. And there's more and more data coming out. It seems like every week, and more companies launching that are, it's like an oral prebiotic or probiotic or postbiotic or symbiotics. And then now tailoring protocols bio-individually to what that patient has. And also, if you're treating the patient, you have to treat the partner.
Great point.
You have to, or the whole family.
Yep.
Why does this patient keep coming in with disease?
What are some of the main causes you see of it? When someone has some sort of dysbiosis of their oral microbiome, what are some of the things? And because I have laypersons that listen to the show as well that thinking like, geez, is it me? Or, and what are some of the testing options they could do? Or do they ask their dentist about this?
Well, I mean, I think it all comes down to terrain. What is off in the human's body to allow these pathogens to take over? And that could be issues with diet or immune health or detox pathways, environmental toxins, hygiene, certainly, there's so much, how you're breathing, etc. So things can get off pretty easily, but if your body and your immune response is optimized and you have a healthy, robust, diverse microbiome, you can crowd out these pathogens and no harm, no foul. But most of us are not optimized. I mean, look at COVID. We see how many humans out there are metabolically challenged right now, and it's really high. I mean, it's over 85% right now. So the ways to know, just simply, do you keep getting cavities? Do your gums bleed? Or have you been told you have periodontal disease? That's when your hygienist is measuring, 4, 3, 5, 6. They're measuring the attachment health around your gum. Do you have bone loss? Is there bleeding of your gums? So, but also chronic bad breath is a big one. Or tonsil stones, dry mouth. And now we're learning more too about the sinus microbiome and how the sinus microbiome is impacting the oral microbiome and how the oral microbiome is impacting the lung microbiome. And again, we saw this in COVID as well. Like a lot of patients with negative outcomes in those early days who were intubated, they weren't passing away from COVID. They were passing away from secondary infections in the lungs. Often coming from the mouth because there was a vector now to carry the bacteria down in there and create issues. So those are the big ones. I mean, the bad breath one. And what do? If you have bad breath, mouthwash,
right. We'll walk around the little Listerine tabs, right? That you see people with. Yeah.
That's your body yelling at you that you have something off in the system. And we tend to ignore these signs from our body. And we're trained as dentists to facilitate our patients ignoring them by selling them products. So, and we know that a lot of these strong alcohol and astringent rich rinses there's data to support they're doing more harm than good. They're wiping out our nitric oxide producing bacteria and they can increase blood pressure. There's some links to cancer too with really chronic use. That makes sense. You're putting something pretty aggressive, arguably caustic into the mouth multiple times a day that can have an impact on cellular health certainly too. So microbiome testing, there's different types. Oral DNA is a common one that people will use when trying to target specific periodontal pathogens. There's direct to consumer ones now, which is what I recommend because it's hard to find providers offering these. But Bristle is one, like a toothbrush bristle. It uses shotgun metagenomics. You literally wake up in the morning, you spit into a tube, you mail it out, and you get a full breakdown of your bacteria. It can test for viruses and gut health bacteria and how they're interacting, and they're continuing to refine and tweak the test. Viome is another. I mean, there's just more and more popping up, but
and they help with interpretive data as well. So even if your dentist doesn't know how to interpret this, because I don't say that as a slight or a knock to the dentist, we're not taught this. So
we're not taught it.
Okay, so there is a reliable source on the other side that's helping you interpret this information.
They have protocols. I think we all would agree there's room for improvement, but it's just because we don't necessarily have all of this. Although I am helping co-launch the Institute for Functional Dentistry. And we have some of the top microbiome lecturers and hygienists coming in to actually discuss protocols, because this is my issue. No matter what space you're talking about, you go to airway training or microbiome, it doesn't matter. A lot of the education is like the basics.
Yep.
It's to get you, it's sort of like the hype guy lecture, like, oh my gosh, I love this. What do I do? And then there's no protocols.
Yep.
It doesn't teach you what to do Monday morning. And so we really want to change that. So if someone's interested, I do encourage that training. I'm going to take
Can I put a link to it in the show? Is there something I can link to? Is it up and running? Okay, great. Okay, I'd be happy to.
Partly, but I think we're at the forefront of this, and it's like the whole test, don't guess. Like we've just been practicing pretty archaically, and I think we need data, and this is how we create bio-individualized treatment plans. Yeah,
I love it. So I know we're coming up. We've got a hard stop here. Before we finish up, if you could just leave the audience, both the professional colleagues, as well as laypersons, with 3 to 5 things that they could do to proactively or not do, right? Things that they need to stop doing. But what are some of the action steps they could take to create a healthier oral microbiome and healthier mouth that's more resistant to decay and doesn't set them up? And we can even take it into the airway side too. I mean, certainly that could be as well, but facilitates normal craniofacial growth and development, minimizes neurocognitive and behavioral impacts, minimizes the need for invasive mechanical treatment down the road. What would 3 to 5 of those things that you could just say, these would be really key ones to focus on?
Yeah, I always fall back to nutrition. I mean, I encourage everyone to keep a little food diary and share it with a provider, or we have ChatGPT now. I mean, just put it in there with a good prompt. But you're often nutrient deficient, you're mineral deficient, and your eating frequency is probably unideal. I see that a lot. Like we eat too much, we sip too much, we drink too much, and this is impacting the microbiome. And getting back to whole foods, I teach the kids, eat from things from farms and from the earth and less from factories, less packaged food. It's an oversimplification, but meat and vegetables is not why we're having and fruit, I'd even argue, is not why we have a decay crisis. Okay. Yep. It's the goldfish crackers and the chips and the pretzels and the granola bars and the Go-Gurts. And the Gatorade and even the LaCroix
and the Celsius and the older kids and the people think, I have one that doesn't have sugar. Well, the acidity of those is tremendous. And I worry about the gut microbiome and oral microbiome that those drinks are having. I don't know any data off the top of my head on it, but I just you look at the can, the chemicals and those things, like this can't be good for the microbiome. Yeah.
And you're right. I mean, anything you put in the mouth, this is where people can have different opinions about the seed oil conversation, the food dye conversation, the preservatives conversation. But I would just say, hey, what is it doing to the microbiome? Like, can we study that? Like, I would imagine probably it's not great for it because this isn't how these species, we didn't evolve this way. We weren't be exposed to these things. So food first, nutrition first. Making sure you're getting enough fat, soluble vitamins, and minerals. I mean, I think that's foundational. The next thing I would add on to that is don't underestimate the importance of your saliva, your spit. We are dehydrated, and we'll see mineral deficiencies and vitamin deficiencies there too. So your saliva is so protective of your teeth. It's important for speech and swallowing and digestion. So appropriate hydration with electrolytes and minerals is essential. And then breathing, airway. So if a kid comes in with decay and we can't figure out why, the first thing one of the things I think is I bet they're mouth breathing. When you mouth breathe, the pH drops to be acidic, that you lose that healthy saliva I mentioned, and your caries rate, your decay rate, your gum health, you can just decline very quickly. And then, I would say stress. So this isn't one people think about, but stress does impact salivary health. Cortisol impacts salivary health. We all tend to be a little stressed. And so learning to try to slow down and instill self-care, and whether it's meditating or journaling or just taking a moment in your car before you go in at night from the office to home, like we need to think hormones and and circadian rhythm and just how does this impact oral health too? And that could be bruxing and clenching and all of these things. But I would say stress, and that's a hard one. I mean, I struggle with that too. I really do. And I acknowledge it and I do the best I can. But I'm fortunate not to have a lot of dental disease. But, if you do, I would really look to that. And then, this is further down the line, but it is hygiene. If you're eating some of these more modern foods, you have to have really great hygiene. I think if you're eating more ancestrally, more of a paleo diet, and I'm not advocating for any certain diet, but you get more of a free pass. And I'm not saying no one should participate in hygiene, but those that are eating more packaged foods and more fermentable carbohydrates and things, you have to have great hygiene, particularly flossing or water picking. And I think we as dentists have forgotten to educate how important interdental cleaning and flossing is. Like everybody is, but like flossing is still this afterthought. We need to flip that, in my opinion, because a lot of these bacteria, they're anaerobic. They hide out in between the teeth and down in the sulcus. And, it's an important place that we need to educate patients on. So, and then just educating on the oral systemic connection. Like people don't take their oral health seriously. It's kind of an afterthought, and we've normalized disease. And like now we're learning, oh wait, it increases Alzheimer's and risk and can lead to erectile dysfunction. I mean, this is how you get your patient's attention. So learn to educate on the things that will motivate your patient, and that will change depending on who you're speaking to. But that's our role.
So awesome. I could talk to you about this all day. Literally, you're such a wealth of knowledge on this, and I give you such credit for being a warrior and a trailblazer. It's not easy. And you're doing this as a mom with young kids and a wife and a business owner. And it's amazing. I could see why you might have a little bit of stress. I give you credit for not having more stress, truthfully, because it's amazing. And you're changing the landscape. You're shifting the paradigm. And I get it may not always feel like that, but I talk to a lot of people in my capacity to what I'm doing now. And you're trailblazing. I mean, you got Ron Huberman with him that gets heard all over. You're really doing amazing things. And I just encourage you to keep fighting the fight. I know it can be tough. I know you're probably taking a lot of arrows. Don't give up. You're going to change this profession, and people are going to look back to interviews like this and hear the things you're saying. And even if they heard it today and thought, I don't know, I guarantee in 5 years, 10 years, people are going to say, wow, she was right. So keep up the fight. How can people reach you? Can they, or anything that you are promoting, or I'll put the link to the new group that you're building as well. But anything else that you want to highlight?
That was so kind. You have no idea how much that means. Thank you. I feel the same for you. So please keep at it too.
Thank
Truly.
You. Appreciate it.
Yeah, I'm like a little emotional. Thank you.
It's true.
It's the Institute for Functional Dentistry. We'll include the link. It's launching in January 2026. We're ally partners with the Institute for Functional Medicine. So it's a residency level program. I cannot recommend it enough. I'm going to take it. We have curated the top 30, I think it's now 40 now faculty members. Like these are thought leaders from around the world in our industry to be founding faculty. And so if you want to practice differently, it is for everyone. It is for anyone in the dental profession or auxiliary team members. We have different tiers. So I do recommend a look into that. And then my website's drstaci.com. Doctor is spelled out. It's STACI. And I have education there. I have handouts I always say to any provider, please reach out to me. I'm here to help support you and maybe mentor you to the best of my capacity with my time. But then I'm also on Instagram, Dr. Staci, and I try to offer a lot of education there too. And I encourage all of you, if you're a provider, don't shy away from utilizing social media. It's not only a beautiful marketing tool for your practice, but I think you'll find a huge sense of purpose through education, and you're helping so many people. It doesn't matter if you only get 10 likes. Those are 10 people that you just helped educate. That's huge. So don't get caught up in the algorithm and the metrics. That stuff means nothing. It's about changing the course of human health and helping our fellow neighbors, So Yeah.
Well, you're doing it. You're doing it. Keep it up. It's a pleasure getting to know you and speaking with you. Thanks for your time coming on today. And let me know how I can help with anything you're doing going forward. I mean it. I think we can. There's a lot of ways we could join forces and team up to keep advancing our purpose in both of our missions. Dr. Staci Whitman, thank you so much.
Same. Thank you, Mike. I appreciate it.
Bye. Thank you for tuning into this episode of the Doc Podcast. Be sure to visit theorthocoach.com to get access to ADA CERP recognized CE courses or to schedule a private one-on-one coaching session with me. Also, if you know of someone who would make a great guest for this show, or if you'd like to be a guest yourself, please email me at drmike@theorthocoach.com. And be sure to join the Doc community on Facebook for more great content. Thanks so much for listening, and always remember, you have been blessed with the ability to do amazing things.